Hey folks, Dr. Sean Bryant here, back again with E3 Chiropractic and Wellness, and today we're going to continue our discussion on rib joint dysfunction. Specifically today, we're going to be giving you some info regarding the in-clinic assessment, so things that we would do in office here to evaluate and see what's going on with the rib pain that you're presenting with. So first and foremost, like any assessment here at E3, our initial assessment's going to begin with a very thorough history. So lots of questions from me to any patient with rib pain. There's going to be a lot of chatting about what bothers it, things that relieve it, any positions that you find just seem to be really bothersome, or activities that you seem to be bothersome, and anything that you have done to seem to relieve it. We ask a little bit of questions regarding any of the red flag symptoms that we might notice. That way we can kind of catch it early on and then direct you in the proper referral care from there. So as we kind of shift past that really thorough history, we go into our physical exam. And we start that physical exam with a really thorough movement screen. So we work through both active and passive ranges of motion in the neck, in the mid-back, as well as the shoulders, as all three can be very closely interrelated when we're dealing with rib pain. So we take you through those series of motions, and then we kind of position you in those motions. Once we get an idea for how things are moving, if there's any movement limitations, we then start to dive a little bit farther into specific orthopedic testing. So those are kind of designed to specifically provocate and kind of aggravate that pain that you might be feeling. It's definitely not the funnest part of the exam, but gives us a lot of information clinically as to what's going on. Something that we do here specifically is kind of shifting our focus into, can we reproduce or can we decrease the amount of that pain that you're feeling through repetitive movements in our neck as well as our mid-back? So this is where we kind of shift the focus into mechanical diagnosis and treatment, or a McKenzie approach, I guess, into seeing if there is a neck referral or a mid-back referral component to the rib pain that you might be experiencing. Common directions that we check out with these typically end up being cervical retraction, so kind of our chin tuck, as well as our extension through the neck. And then we can also get mid-back extension, and that can be done with some overpressure from the clinician or kind of over a chair yourself. We also take a peek to see if there's any sort of cutaneous neural sensitivity, and that basically means that we're going to be taking some of the skin around the area and pinching and pulling and lifting off. So we see if there's any irritation side to side, or more sensitivity side to side, to see if there's any sort of cutaneous sensitivity that we can address at that site. So that's kind of some common nerve entrapments in the intercostal muscles. Those intercostal nerves can typically get tender and sensitive, and we can use the dermal traction to end up treating that. Of course, if we're dealing with rib joint dysfunction, one of our main components of our assessment is going to be muscle palpation and palpation of the joints themselves. So typically that's done with us kind of feeling some of the sore and tender muscles in the area, seeing if they're hypertonic or really tight, spastic, anything like that. We would also challenge the joints in certain directions to see if they're limited in any motion, and we would find out which directions those would be. So to end our assessment, we always check, again, we've talked about those common reasons: the improper breathing pattern, poor low back stabilization, and poor scapular stabilization. So to end our assessment, we would be checking your breathing pattern. So typically we would get you to lay on your back, knees up. It's a really easy position to check this in. One hand on the chest, one hand on the belly, and then get you to breathe. And then we just assess, are you breathing in through the belly and in through the diaphragm, or is there a big chest component to this respiration cycle? We would also check scapular stabilization, and one way that we do that in clinic here is to actually get you on your hands and knees, and then we get you to rock all the way backward, rock all the way forward, over and over, to see how the stability of those scapula are in relation to each other when we start to fatigue those muscles. That covers a little bit of the in-clinic assessment here for rib joint dysfunction. Tune in next time to see how we can deal with it in clinic here. Thanks.